Hi, this is Becky. I'm going to take a few minutes to try and explain the difference between private and public healthcare systems. After a brief explanation of the two systems, we will take a look at how the systems work in Australia and Canada. Then we will take a look at the current, though ever-changing, private American system. To begin, a brief overview. Private health insurance allows individuals to choose a plan that fits them best based on the coverage needed, medical conditions they have, and premiums they would like to pay. Private health care offers more options for coverage, but its high prices and premiums leave many citizens at risk of bankruptcy after catastrophic illness. Providing health care for citizens' illnesses without out-of-pocket expenses is the main goal of the public systems of health care. Public health care is a basic non-profit form of insurance available to any citizen, with the premiums going to the federal government to cover the costs of health care. The focus is on preventative care for all citizens. According to figures from the Britain's National Health Service, as reported by Forbes magazine, providing a public health option lowers overall health costs by ensuring proper preventative care for all its citizens. Let's begin by going to Australia to get a brief overview of how their system works.
Ever wondered how it works when we get sick or need medical help? In Australia, we're looked after by a health system that has two parts. The public part, run by the government through Medicare, is paid for by our taxes. When someone like Alison, for instance, gets sick and needs to see a doctor or specialist, get medical tests like x-rays or blood tests, take prescription medicines, or be treated in a public hospital, our tax money helps pay for it. There's a few things to remember about public health and Medicare. Alison won't pay anything to go to a public hospital, but she won't get to choose which hospital or which doctors treat her. She might have to go on the public hospital waiting list and wait a while for her treatment, although if it's an emergency, she'll be treated straight away. Medicare doesn't usually cover the full cost of doctor's visits, tests and prescription medicines, so Alison might have to pay some money towards them. The private, or non-government part of the health system is made up of private hospitals, health insurance companies and other health providers, like dentists. If someone like Ray here gets sick and wants or needs things like treatment in a private hospital, ambulance trips, dentistry, eyeglasses, and treatments like physio and acupuncture, he can get them through the private health system and pay for them himself, or get private health insurance to help cover the cost. There are some things to remember about the private health system too. Ray won't have to wait on a public hospital waiting list. He can choose which hospital and which doctors treat him, and he may get his own room. While Medicare will pay part of Ray's doctor's bills, he'll have to pay for everything else. If he joins a health insurance fund to help pay for his treatment, he might have to wait a while before he's covered. That's called a waiting period. So, that's how it goes. The public health system provides a basic level of health care. Our taxes pay for some or all of it, and there can be waiting lists for public hospitals. The private health system provides things the public system doesn't. There's no public hospital waiting list, but you pay for things yourself or through private health insurance. So, that's it for now. Look after yourself. We'll see you around.
Next, let's go to Canada and listen to Steve Crowder's experience with PJTV in the public health system there.
Which is why I've decided to go through the socialized Canadian healthcare system with a couple of my favorite Canadians to show you exactly what it's really like. Now, it's important to know that this was all done guerrilla style. All right, first things first, we wanted to head down to the local clinic and see what kind of treatment we'd get there. But it was the weekend, and as people in the emergency room later told us,
so I guess the clinic is closed on Sundays or weekends. Weekends, it says. I guess we're going to have to go to the hospital. So we were told to grab a number. Yeah, 770. I don't know how long that'll be. This is what? What'd you call this?
Triage.
The triage? So Okay.
This
What
is
does that mean?
triage. That means we wait and we get judged by the nurse and decide how important we are.
Excuse me. Can you tell us approximately how long the wait's going to be?
2 hours or 12 hours.
So between 2 and 10?
So lots of waiting today.
So which days are usually the shortest or the longest days for waits here?
No day.
No?
All day night. All day and night.
It's always long?
Yeah.
Yeah.
So we waited. And waited. Until honestly I realized that PJTV doesn't pay me enough.
All right, so we just left the hospital. We had been waiting for, say, at least 4 hours, and a guy with a broken clavicle who was in there, it took him 5 hours for a turnaround to finally get his care, and they finally couldn't do anything. They just told him to go see an orthopedic tomorrow. And there was another guy in there who was waiting 9 hours for penicillin, so considering that Tim had a what we thought might be a broken wrist, he wasn't such a high priority, and we were not going to wait around for 9 hours today. But we'll give the clinic a shot tomorrow.
Now, granted, emergency rooms can always be really tough to deal with. But what if a Canadian wanted to get something simple done, like a blood test? Well, it just so turns out that John wanted to do just that. He wanted to test his cholesterol levels, but doesn't have a family doctor. We went to the local clinic to find out what he needed to do. Until finally, we were able to see the nurse. At least this time she was friendly.
So why you come here today?
I was looking to get a blood test.
No, don't do it. Don't do it here. No.
I can't get a blood test here?
No, if you're sick, maybe we can see if we need that, but no for see it for.
Well, he doesn't need a blood test here. He needs to get a slip.
Yeah, can I get
a blood
like
test at the CLSC?
Okay.
And he doesn't have a family doctor.
Okay, because if we ask the blood test here, the doctor that prescribe blood test need to make un suivi. C'est quoi un suivi? Need you need to be your patient. Okay.
Right, but it's hard to get a family doctor,
Yes,
and he doesn't
I
have
know.
one.
But the only thing that you can do is just call the phone number. No?
I did.
Okay, and just ask how the clinic if they have family doctor and give your name to the list that they have.
I did that like 3 months ago.
Yes, but
and
maybe it's like 2-3 years.
3 years
Yeah,
to get a doctor?
But you're young, so you have the time. Normally, they don't have problem at your age.
They suggested I get a family doctor, but that's what I was calling for. And
Yes. Now you need to wait. So, or you go in the clinic privé.
okay. Is there one near here?
Yes.
That's
Yeah.
where you have to pay?
Yes, it's 900 cost for you have a health checkup, okay?
Okay.
And with that,
$900?
yes, 900.
Wait, did she just recommend what I think she did? Paying for better health care? Oh, skunked again. Looks like we'd have to wait another day. So we managed to fit it in within their ridiculous hours, only to be told...
So you haven't had any
For
doctors here
3 years ago, Longueuil, Candiac, Brossard, St. Hubert, none.
Why?
Ask the government.
The government? No doctors, what, they don't pay, it's not enough money here?
I
or?
don't know, but if you have cash someday, you will have a doctor. We're going this way.
Some days if you have cash.
That's it.
Oh, well, I appreciate your honesty.
Because we went to the clinic and I waited and I saw the doctor there and she said, well,
You see a doctor here.
yeah,
No,
she
yeah,
said,
no,
or
everybody
see a family
say you
doctor.
Go there, come here, go there. But there's a private clinic. Would you like to pay?
Wait, hold up. A government employee recommending a private clinic? So, believe it or not, after all of this, the lady upstairs, as you just saw, referred us to a private clinic. She seems to think that would be a little more efficient than the Canadian government, but as we said, that goes against the rules by which we're playing right now. We want to experience the kind of healthcare that Canadians pay for with their tax dollars. So, the quest continues.
This is not everyone's experience, but at least it gives us some of the potential problems. Finally, let's take a look at the private health system used in America. According to Robert and Jeanette Lauer, the private medical insurance system is a health insurance that is purchased from companies. There are 3 basic systems: HMOs, which are health maintenance organizations, 2 types of HMOs, not-for-profit and investor-owned. The idea behind them is to offer people a comprehensive prepaid health care plan. Individuals pay an annual fee, receive total medical care, including hospitalization and surgery. The second type is a POS, or point of service. This allows a patient to go to a healthcare provider outside the HMO, but the patient must bear the additional cost. The third is a PPO, or a preferred provider organization. This is composed of a network of physicians and hospitals that offer care at discounted rates. In a free market system, the product must be brought to market. Let's take a look at what that looks like. The following is an advertisement by InsureX Solutions, a private insurance exchange.
Hi, I'm Bob. This is my company, and these are my employees. I'm really worried about the cost of my employee benefits program. I wish there was a way to offer a better program for me and my employees.
Now there's a way. InsureX Solutions is a private insurance exchange designed to help employers just like you. It allows you to offer benefits at a fixed cost with no participation requirements. Plus, there are tax advantages for you and your employees.
Sounds great. How does it work?
It's simple. All you have to do is choose how much to give your employees and who is eligible. InsureX Solutions takes it from there. We handle everything so you don't have to. Your employees will log in to the InsureX Solutions online marketplace. They can then search for an individual or family health insurance plan that fits their needs. Our interactive shopping experience allows employees to select specific premium, deductible, and co-insurance amounts, sort results by price, deductible, or insurance company, run a side-by-side comparison of their top choices, and apply right online. At any time, your employees can contact our Interaction Center, where a team of licensed insurance professionals are available to help.
That's fantastic. How do I get started?
Contact a health insurance producer or contact InsureX Solutions directly. You can also visit insurexsolutions.com to learn more.
One important consideration to remember. According to the New England Journal of Medicine, countries that have offered only public health care, such as Britain, France, and Canada, have begun allowing privatization of insurance. Conversely, the United States offers public health care plans in certain areas. This indicates that a balance between the two may be most helpful to meeting citizens' needs.